Here we are at London Stansted Airport in the Orbis Flying Eye Hospital. It launched in July of last year, and its first clinical mission was to China. For the next 2 years, it'll be alternating between goodwill tours, such as the one we have here today, and clinical tours, which are going to the countries where we work very often. The Flying Eye Hospital is important historically because that's how it started, when the founding fathers of Orbis started the Flying Eye Hospital. I think it was in 1982. Their concept was that they would take the expertise to developing countries. Quickly we realized that you couldn't actually get as much reach as you wanted to. So we then started country offices. We now have 15 offices throughout the world. What we want to do is to transfer skills and to support those doctors and nurses and optometrists to be able to serve their own country. The aircraft plays a relatively small clinical part in what we do now, about 10%. But it has a very, very important part in advocacy, in going to countries and persuading those governments to put a greater proportion of their GDP into health and healthcare, and particularly ophthalmology. The original aircraft, which was an old Freddie Laker aircraft, the airframe was becoming very old. We had to make the decision as to whether the aircraft was useful and valuable to Orbis as a whole and to the people we serve. After a lot of debate, we decided that it absolutely is valuable, and so we commissioned the new aircraft. The actual building of the aircraft and the modules took about 3 years. In all, it probably took about 5 years, but it's been incredibly successful from our point of view. It's given us greater reach, so we can fly further for less money. We can land on many more airfields than we could before, so that we have a much more useful and functional aircraft than we had before. When we land somewhere and we go to a country in the aircraft, you'll have a doctor and nurses being trained here in the operating room and in the sterile services room next door. And so they're going through the whole process, so you're learning everything. And so that the doctor you're teaching here may well be the one who's doing the operating, and you're teaching him from the side, or he may be watching you doing it. And as you're operating, you are teaching the people in the classroom at the front. It's all live, which can be quite exciting, who will be saying to you, "Tell me, doctor, why exactly did you do that then?" You know, that can be quite difficult to answer. The volunteers will come for 1 to 2, maybe sometimes 3 weeks, and they will volunteer on this aircraft to demonstrate their technical skills here. But they'll also go and work in the local hospitals, because that's really important, and you can then fill the gaps for them. So you'll say, your microscope is difficult to use, we'll supply you with a new one. Ophthalmology in developing countries is the same as it is anywhere else, apart from the fact that the disease burden is much greater and the degree of disease is much greater. But it's the same in that you need a team, and it's one of the things that we've always been very keen on, especially over the last 10 years, is supplying a team. So you need your theatre team, you need your supporting medical team, you need your anaesthetists, you need optometrists, you need biomechanical engineers who will actually mend the equipment and teach how that equipment is mended, and you need administrators. So you need an entire team, and so that's what we do. So we don't just teach ophthalmology, we teach everything that is required to provide an ophthalmological service in the countries where we go to. My first trip was to the Sudan and Khartoum, and it was just extraordinary, really, because before you go to developing countries, you think you know a lot about ophthalmology, but when you go there, you realize that actually you don't really. And ophthalmology in developing countries is very, very different, because the extremes of disease are so marked. So a cataract we see here in the United Kingdom will usually be relatively mild. The cataracts you see in Sudan or in sub-Saharan Africa or in the poorer parts of Asia these people are blind from their cataract. I think if you're in medicine, you've gone into medicine not only for the thrill of the science and the interest, but because you're interested in people and because it's about giving back. And there's no better way of giving back than to give to those people who absolutely have no hope otherwise. They have no hope. If you don't meet them and they don't meet you, or the Orbis team doesn't meet them, no one will meet them and they will never be treated. And that's the most extraordinary feeling, and to be able to engage with countries so that you can develop the capacity in that country, so you can support ophthalmologists in their countries so they can treat their own people. There's nothing better. It's a wonderful, wonderful experience.